Hey, this is Dr. Tejas Patel with Cosmetic, and we often get a lot of questions in regards to dental implants, especially about complex cases where a person's missing multiple teeth or has many teeth that are breaking down, and they're looking at losing a lot of teeth and are curious on what are the options on how to replace multiple missing teeth. So I wanted to show a case and go over it with you in regards to, when we're planning out this implant procedure, what are we looking for, and what makes a good candidate, and what are some of the precautions we want to take. So let's look at it together. So when we're looking at a panoramic or a 3D image of someone's mouth, we can see that the patient has the upper jaw and the lower jaw when we're looking at the basics of it. We can tell that the patient is missing many teeth in the back of his upper jaw on the right and left side, as well as on the lower jaw as well. We can tell there's some bone loss in the lower front area of his mouth, and we can tell that he's had some major restorative dentistry on the upper left side of his mouth, and actually he had a bridge here as well that was broken or came off or came loose. You can tell he's had a root canal. So a couple of things we're looking at when we're planning a complex dental implant procedure, or in his case when we're thinking about doing a teeth in a day procedure or all-on-4 procedure, is we're looking at where his sinus cavities are. We can kind of tell there's a faint line here, which is his sinus cavity wall on the left side and his right side. And that's one thing we look at for the upper when we're going to angle or place our implants. We want to be aware of where the sinus cavity is. On the lower jaw, what we get concerned about is there is a nerve that runs through the lower jaw, and we want to make sure when we place implants, we place him in such a position where we don't irritate or affect the nerve. So that's a consideration as well. So when we look at these 3D scans or these panoramic x-rays, we're evaluating where implants can be placed based on the amount of bone volume we have. But then also we're verifying where certain anatomical structures are, so we don't interfere with those or damage or cause any harm to those areas. So again, just wanted to get you more information in regards to dental implants and how we plan these complex implant procedures. Again, this is Dr. Tejas Patel with Cosmetic. If you have any questions in regards to dental implants, be it from a single tooth or a few missing teeth or something more complex where maybe if a person has a denture who wants to upgrade and get a more permanent solution, or if someone is missing multiple teeth and just doesn't know what to do and wants to know their options, we offer free CT scans to evaluate your case and complimentary consultations. So if there's any way we can help you out, please feel free to check us out online and reach out to us. We'd love to hear from you. Thank you.